Right now, though, a new post-lockdown survey by the Heart Foundation has revealed Aussies are craving healthier food options, with 90% saying that they think the most important feature of a neighbourhood is access to fresh food.
But if that's the case, why is heart disease still the #1 killer, with a large section of our population considered overweight? Clinical nutritionist Sarah Lorenzo joins us now. Sarah, good morning.
Good morning.
We're still not making the right choices when it comes to food. This information with regards to heart disease, it's really important.
It is. But what's interesting is that poor diet is definitely a contributing factor to heart disease. And Australians are still choosing foods that are going to increase their risk of things like blood pressure, their cholesterol, their weight and their diabetes risk.
Which essentially is going to impact their life in such enormous ways.
Oh, absolutely, yeah.
Particularly high blood pressure. So what can we eat to bring our blood pressure down?
OK, so the foods need to have antioxidants in them, as well as potassium and calcium. So on podium 1 here, I've got these foods, and it's interesting with the antioxidants, with the berries and the tomato, you can actually see when you look inside a tomato, it actually looks like a heart. It's interesting how fruit and vegetables can actually mimic the organ they support. So to relax blood vessels, it's the celery and the carrot. Pistachios, a recent study showed that pistachio eaters every day have a 28% lower chance of high blood pressure. And spinach, well, spinach contains the antioxidants, the potassium and the calcium that all are fantastic for reducing blood pressure.
What about podium 2? There's some dark chocolate there.
So podium 2 is all about reducing cholesterol. So these are all foods, and it's all about fibre, it's about omega-3 and it's about antioxidants. So I always tell all of my patients, really look at getting fibre in your diet for that blood cholesterol regulation that you'll see with the oats. Omega-3, which is going to support our HDLs, with the nuts and the avocado. With the antioxidant support, it's the kale and the grapes. LDLs can be brought down by tofu and dark chocolate. Just a couple of squares a day have an antioxidant in it called a flavonoid, which helps reduce cholesterol.
Can I just ask, how do you make tofu palpable?
I love tofu.
No way.
No, in a curry.
I've heard silky tofu.
I know, that's not my favourite.
There's just
hard
no way.
tofu.
Tofu's like a wet sponge.
OK, it's not.
Sorry, sure.
I like to dice it, and I will dice it and I dry fry it and I throw it through vegetables in a stir fry. I love tofu.
Apologies to all the tofu lovers out there. But I do stand firm, it's like a wet sponge. Podium 3. OK, podium 3. So this is all the foods. The mistakes people are still making is they're including foods like this in their diet that are going to increase their LDLs, which is the bad cholesterol, and they're also going to increase things like their triglycerides, which is the fat that floats around the blood. So these are the mistakes people are making by still having that. And even the diet drinks, anything that has sugar, diet light, it is still going to be damaging to your heart. There's a lot of evidence to support that. So we need to avoid this. As well, making lifestyle choices are really important, like getting a lot of exercise, reducing smoking, alcohol, getting a healthy diet. There's a lot of really important things people need to do to really get heart smart.
I can already feel our Facebook page going into meltdown over the next recipe that you're going to give us, because this is something that you suggest.
I suggested this and I love this. So what I've done is I created this for this segment. So it is a heart smart pancake. So of course I've got the oats in there. I love oats, and I've put banana in there as well. Egg's interesting. People often think that egg is bad for cholesterol, but it doesn't increase the LDLs, which is the bad cholesterol. Bit of cinnamon. I've used olive oil instead of coconut oil that you would probably use in something like a pancake, and the cinnamon for blood glucose stabilisation. It's completely delicious. The sweetener I put in there is honey, and honey is actually probably the best sweetener for the heart.
And it's got bananas
Yeah,
too.
and a bit of banana. Banana's got potassium.
Well, we feel bad because we are always hogging it, and our floor manager Matt is complaining about it. So Matty, you get to come in and try it.
We're not even allowed this. You've got us on day 25 of a diet.
I know.
And we're not even allowed the health thing.
Yes.
I mean,
So you're the taste tester.
It's good.
It's delicious, isn't it?
Nice.
It's delicious.
You seem so surprised.
Well, if it's healthy, you're kind of like, ooh, is it going to be good?
Yeah, exactly.
But it's yum.
It's yum.
Fantastic.
It's really
Thank you,
delicious.
Sarah.
Everything that Sarah Lorenzo gives us tastes delicious.
Thank you,
so
darling.
much,
Thank you.
Sarah.
Except
Lovely to see
tofu.
you. She can make that taste good. See you next time.